So, N-nitrosamines are a class of carcinogenic chemicals typically found as impurities that present a major risk to the health of patients due to the ease in which they can form and their mutagenic properties. Many active pharmaceutical ingredients, or APIs, contain nitrosatable amine groups and are therefore at risk of forming N-nitrosamine drug substance-related impurities, or NDSRIs. Regulatory authorities require pharmaceutical manufacturers to risk assess all pharmaceutical products for the presence of N-nitrosamines, and where a risk is identified, develop methods to analyse them. Hi, I'm Tom Kershaw. I'm a scientist at Resolian in the Analytical Sciences Department, specialising in trace analysis of nitrosamines in pharmaceutical products. In this project, a formulated drug product was identified by the client as presenting a risk. Therefore, at their request, we performed a tailored method development. Once we could identify the analyte, the NDSRI, on our mass spectrometers, we performed stationary and mobile phase screening using common columns and phases to utilise the differences in chemistry between the analyte and API to change their retention time relative to one another, as the API is usually the largest co-eluting interference. Following this, we performed an experiment to determine if the absence of nitrosamine we were seeing was genuine by smoking a known quantity of analyte into the sample where the concentration relative to API differed at 0.5 micromole, then 0.1, and finally 0.01. As we can see from these chromatographic traces, we would expect the 0.5 micromole to have the largest peak if the analyte was present in the product, or if the analyte was not present, then all traces to have the same intensity. However, neither of these are true, indicating suppression is present in the samples. Using a full scan on the MS, we determined that a polysorbate was co-eluting with our analyte as evidenced by this telltale chromatogram. Based on prior experience, a pentaphenol stationary phase can be used to provide alternative selectivity to a C18 phase, separating the polysorbate from the analyte. However, when performing further recovery experiments, we found that additional excipients were co-eluting and causing suppression. Using a known list of excipients, we determined that 2-benzoates had the potential to co-elute. By performing further mobile phase screening, as the column cannot be changed without risking the polysorbate co-eluting again, the benzoate B was able to be baseline separated by 0.5 minutes. Therefore, following method development, the performance of the method was greatly improved, as we can see in Table 1. By undertaking this, we increased confidence in the fact that the levels of analyte was below the detection limit and was not artificially suppressed, and that this was indeed a genuine result. Furthermore, as it was a limit test method, separating the excipients allowed for repeatability and precision to be validated, which, while not necessary for a limit test trace analysis according to the ICH Q2 guidelines, by performing these experiments, we can add increased confidence to the results. I hope this case study shows the benefits of a tailored method development approach for ultra-trace detection of N-nitrosamines in formulated drug products that we perform here at Resolian. Thank you for your time. This was a quick overview of the method development here at Resolian. Please feel free to contact us or visit our website for more information.